Hi, Dr. Odell. I was wanting to talk about referring a patient for orthodontic treatment. It's quite an involved case, needing a multidisciplinary approach.
Multi-what? Never mind. That's great. I've never gotten to work with a real prosthodontist before. This will be a lot of fun.
Yes, our patients require a great deal of accuracy in their treatment needs. I have a wax-up for a full mouth reconstruction. The patient has both the skeletal and dental class 2 relationship bilaterally. I was wondering if you could help out with that.
Oh yeah. We see class 2 patients all the time. Let's go ahead and put brackets on the patient and then have the patient wear headgear for at least 22 hours a day.
Well, can I tell you a little more about the patient?
Oh, well yeah, you can tell me more if you want, but we pretty much do the same thing for every patient. Level and align, see what happens.
Well, the patient is 37 years old. Correct me if I'm wrong, but headgear will only work if the patient is still growing.
Oh yeah. Sorry. I didn't know this was an adult. Have you talked to the patient about Invisalign? Have you heard of that before? It's the coolest thing. It's like having braces without metal. It's freaking awesome. The patients love them.
Well, if you would just take a look at our mounted casts, you can see there would be a great deal of movement needed. We have some rotated bicuspids and some edentulous spaces that will require implants.
You do implants too? We have some awesome little implants called TADs. We don't even have to get the patient numb to place them. They're awesome. The patients love them.
Yes, we do, but can we stay focused on this particular patient? Would you please take these casts out of my hands and look with your own eyes?
Whoa. Is that a semi-adjustable articulator? I haven't seen one of those since dental school. Do you guys still use these things?
Yes. We do. All the time actually. The casts here are mounted in CR. You can appreciate some of the occlusal interferences and lateral movements. Please, just take the articulator.
How do I get this thing to move around?
There's a latch on the back. Just let me show you.
Oh. Yeah, now I see. Why don't all the teeth touch?
Like I said before, these casts are mounted in centric relation. There are some occlusal interferences that prevent the patient from having a MIP equal to CR.
We can probably just let the patient grind into an occlusion on their own. The occlusion just kinda works itself out, you know?
Well, the patient is having a lot of discomfort in the TMJ. She has serious muscle soreness on the left side. She's been wearing an occlusal guard at night until we can begin comprehensive treatment.
Oops. Sorry.
Did you just drop the casts on the floor and break them in half?
Yes. Sorry.
That's just great. I spent $1,000 having the lab wax this case up. You managed to ruin my week in a matter of minutes. Let's just look at the pan. I'll hold it this time.
Okay, let's go to my computer.
I actually brought the film from my office over here.
Film? That's funny. Do you guys still use film? All my office is digital. It's awesome. The patients love it.
Whatever. So do you think we can extract number 5 and 12, then try to retract the anterior teeth to help with the horizontal overjet?
Number what?
5 and 12.
What, 12? I don't remember that one.
Geez. Should we extract the upper right and left 4s, then have you place the brackets?
Wait 1 minute. I do not do extractions in my office. Too much blood. I stick to wire bending and that's it. It's awesome. The patients love me.
I'll have oral surgery extract the teeth, but do you think that it will be possible to move her anterior teeth back enough to correct some of this overjet?
I don't know.
What do you mean you don't know?
Adults are hard, man. You can crank down on some wire for kids, but adults are tricky. They want their teeth to look good when they're done. They complain too much too.
Well, how long will that take?
I don't know. 2 years. Who knows? I just tell all my patients 2 years. It's awesome. The patients love it.